Today we're going to talk about fibromyalgia and what it is, what are the symptoms, and how to treat it. So fibromyalgia, there's a lot of research going into it now, but there's still a lot of mystery surrounding it. So far we understand fibromyalgia as centralized pain. That's where your brain misinterprets signals coming to it from the rest of your body. So just to give a quick example, here's your, not the best artist, but let's say this is your brain and this is your body. That's supposed to be a hand. There was a study done at the University of Michigan where they put pressure on people's thumbs. And then they looked at their brains under a functional MRI machine to see how they respond to that type of stimulation. And usually, if your thumb is pressed, it sends a signal to your brain, and then it says, your brain says, hey, it lights up. Hey, someone's touching me. Someone's putting pressure on my thumb. People with fibromyalgia, when they put them under a functional MRI, they saw that their brain lit up as if hot coffee was being thrown all over them. So they have a thickened pain pathway, and that's called centralized pain. So what are some of the symptoms of fibromyalgia? Many patients with fibro could have headaches. They could have GI upset or irritable bowel syndrome where they get diarrhea or constipation. Some people have more of one or the other, or they could have alternating diarrhea and constipation, all different types of stomach upset. Patients have usually chronic fatigue. They wake up a lot at night. They just don't sleep well. They wake up, they feel tired, they feel exhausted. Patients usually have joint pain, muscle pain. It hurts to be squeezed or touched. And some patients will have some of these symptoms and not others. Other usual symptoms include migraines. Some people have just chronic headaches. Treatment for fibromyalgia. Well, there's no cure for fibromyalgia. There's many treatments and things you could do to help yourself feel better and manage your symptoms. One thing that we like to focus on is treating the chronic fatigue and waking up many times at night or feeling unrefreshed. It's almost like your body is in a fight or flight mode. If you were sleeping on the floor of the forest and all of a sudden animals are coming to get you, it's a good thing to wake up. You could run away and probably survive, whereas someone who's sleeping next to you on the floor, they're not going to make it. So it's almost like a survival strategy. You're in this fight or flight mode. But when you're at home and you're in your bed, we don't need you to feel that way. We want to get you to chill out, get you to sleep well, get you to just feel more relaxed. And if we could get you to sleep through the night and feel better, get you out of this fight or flight mode, a lot of your symptoms will improve. To get you out of this fight or flight mode, this stress state, get you to sleep better, that's why many doctors say, oh, it's important to exercise or do Tai Chi or Qigong or other types of relaxation techniques. It's not because we're trying to say, oh, go home and we don't have anything for you. It's because this was actually proven. There's a New England Journal of Medicine study about Tai Chi in fibromyalgia patients, and they did show in real clinical trials that, hey, these techniques actually work. They help reduce your stress levels, they help you sleep better, help bring down that generalized pain. Other types of stress reduction with cognitive behavioral therapy or other techniques will also help that kind of same direction. We really want to decrease that sensitivity to pain. We want to knock out some of these extra pain pathways. So how do we do that? We've seen in studies that if you do exercise or even just movements such as Tai Chi or Qigong or other types of movement exercises, it creates pain blocking descending pathways, and it does help cancel out this centralized pain that you're experiencing. Getting a diagnosis of fibromyalgia usually involves seeing your primary doctor and sometimes a specialist like a rheumatologist. In order to be diagnosed with fibromyalgia, usually you have to make sure you don't have other underlying causes for these symptoms. So many times your doctor will check your blood counts, make sure you're not anemic, which could cause fatigue. They may check your thyroid, make sure you don't have hypothyroidism or other causes of pain and fatigue. Many times patients come to rheumatology to make sure they don't have an autoimmune disease and that their symptoms are in fact fibromyalgia. Fibromyalgia itself is centralized pain, as discussed. It's not really an autoimmune or inflammatory condition. If you think you have fibromyalgia, it's important to meet with your doctor, make sure you don't have another reason for your symptoms, You could also do a self-assessment to see if you meet criteria for fibromyalgia. I'll post a link to it in my bio. Fibromyalgia could affect people in many different ways. If you have questions about fibromyalgia or the symptoms of fibromyalgia, drop a comment below, and also stay tuned for the next video where we'll talk about some treatment options.